Hi, good day. My name is Massie and Baling from ANN-BSN2-WIEDENBACH. For today's video, I am going to show you the procedure about donning and doffing of PPE. It is the process of putting on and putting off personal protective equipment. And its objective is to provide proper protection for the healthcare workers in the event of exposure to highly contagious and communicable diseases. Now, let us proceed to the procedures.
For donning of PPE, step number 1 is to identify and gather the proper PPE to don. This helps to save time, effort, and energy. Step number 2 is to perform hand hygiene. This removes bacteria, dirt, and other pathogenic microorganisms. Step number 3 is to put on isolation gown. Tie all ties and ask assistance from other health personnel. Isolation gowns will reduce the risk of contamination during exposure to patients with communicable or contagious diseases. Next is to put on mask or N95 mask. Make sure to secure it properly behind the ears. This protects the nose and mouth from splatter of body fluids before inhaling it. Next is to put on face shield or goggles. Face shields provide full face coverage and goggles also provide excellent protection for eyes. Next is to put on the gloves. Gloves should cover the cuff wrist of gown. This protects and guards the hands from touching anything that may cause disease or harm to one's health. After all of the procedure, healthcare may now enter the patient's room. For donning of PPE, first is to remove gloves and ensure glove removal does not cause additional contamination of hands. Use glove-in-glove or bird technique to prevent spread of pathogenic microorganisms. Next is to remove the gown. Untie all the ties. Some gown ties can be broken rather than untied. Do so in gentle manner, avoiding a forceful movement. Reach up the shoulders and carefully pull gown down and away from the body. Rolling the gown down is an acceptable approach and dispose it in trash receptacle. This prevents further spread of harmful pathogens. Next is to perform hand hygiene. This ensures safety and clean hands prior to touching the facial part. After that, remove face shield or goggles. Carefully remove face shield or goggles by grabbing the strap and pulling upwards and away from head. Do not touch the front of face shield or goggles and dispose properly to the designated container. This prevents recontamination of clean hands. Next is to remove and discard face mask. Do not touch the front of the face mask and dispose it properly in the designated waste bin. This prevents the spread of harmful pathogens. After all of the procedures, the nurse should perform hand hygiene again. This helps ensure safety and clean hands.